While COVID-19 has caused tremendous suffering across the globe, it has not plagued every region equally. Some nations have faced more dire shortages of medical supplies, pharmaceuticals, and healthcare providers. Many countries have struggled to procure supplies of COVID-19 vaccines, and most have little or no capacity to build their own vaccine manufacturing chains.
Not only affected the health sector, but also affected the every sector of Bangladesh. At that period, we have faces a lot of problems regarding pharma raw material. And due to lack of pharma raw material, the pharmaceutical price of the pharmaceutical products was increased a lot.
Nayeem's family suffered a loss due to a lack of available medical care during the pandemic. Now, as Deputy Director for Bangladesh's Drug Administration, he's helping to prevent new outbreaks from creating such trauma. Nayeem is taking part in a novel program in the Republic of Korea that teaches experts from 13 developing member countries how to produce groundbreaking new COVID-19 vaccines. The 8-week course is part of an effort supported by the Republic of Korea E-Asia and Knowledge Partnership Fund and ADB to strengthen developing Asian nations' health systems to fight the pandemic. Trainees learn the entire vaccine manufacturing process, including intensive hands-on experience in the laboratories of the Korea National Institute for Bioprocessing Research and Training Center, a teaching facility in the Yonsei University International Campus west of Seoul.
So, as a global vaccine biomanufacturing training hub, Korea will play a role as a global leader in resolving global vaccine inequality and establishing a global health and medical safety net.
The training has brought together not only pharmaceutical engineers and biologists, but also educators, policymakers, and regulators. Ratna, who works at an Indonesian biopharmaceutical company in Jakarta, hopes this kind of engagement will help streamline the process of bringing crucial new vaccines and drugs to market and make her country more self-sufficient in the future.
If we can accelerate this discussion session, let's discuss how to make it better for your side and for my side and for all sides, so that the demand of our local demand drug and vaccine will be supplied by our own.
The plan is to support more countries to be able to produce vaccines. For example, expanding the manufacturing capacity in Indonesia and also supporting Bangladesh to become a regional vaccine manufacturer.
Learning the technology of the new messenger RNA vaccines offers promise not only for the COVID-19 pandemic, but for other serious illnesses as well.
And many of these vaccine technologies have benefits beyond just vaccine production. Some of them have utility for producing new types of therapeutics for chronic diseases, for immune conditions, for cancers. You know, this course is beneficial for future pandemic preparedness, but also for preparing health systems to be delivering the products that are going to be useful for all of us in our everyday living.
As the trainees accept their course certificates, they head home equipped with new expertise and a hope that by the time the next pandemic hits, their countries can help take the lead in producing life-saving medications and vaccines, not only for their own use, but also for the region.